So it is my pleasure to be up here at this podium again on behalf of the Muriel McQueen Ferguson Center, and also from the Muriel McQueen Ferguson Foundation, that wonderful partnership that's there, to introduce the next speaker. And so our next speaker is Dr. Mary Aspinall. Now, her topic is the Awareness to Action Community of Practice Addressing Family Violence in Family Law. We realize how this is going to be very connecting in many ways from the last presentation that we heard. Dr. Aspinall is an assistant professor in the Department of Criminology and Criminal Justice at St. Thomas University. Her research concentrates on intimate partner violence, IPV, coercive control, specialized courts, and community-based intervention programs. Mary previously held frontline employment supporting victims of IPV and continues to serve on a variety of national research teams addressing domestic homicide, policing IPV, and policing coercive control, and assessment of family violence in family law proceedings. So we see many connections in these presentations. Mary has been a research fellow with the Muriel McQueen Ferguson Center since March 2023.
Thank you so much for the introduction. Makes my title slide go much faster. So in that introduction, my little bio there, it mentioned the assessment of family violence in family law proceedings, and that's really what I am talking to you today about, is the Awareness to Action project, which is a national research study, but we have different regions, and so I'm talking to you a little bit in general about this national project, but specifically what we're doing here in the Atlantic region as well. The project itself have their headquarters, as we call it, at the Center for Research and Education on Violence Against Women and Children. Thanks. Or CREVAC, if you will. Just the touchpad there. Okay. So this is where the core management of the work really comes from at Western University. And then we have an alliance of other research centers throughout the country. So the MMFC here being one. We're also working with others such as Resolve in the Prairies, the Frida Center in BC. And so we all have responsibilities for this project within our own regions. So for us here in the Atlantic region, we have Dr. Carla O'Regan. She is the principal investigator. She's been part of this work since its inception, and she's in the Criminology and Criminal Justice Department with me at St. Thomas University. I'm newer than some to this national project. I've been the project coordinator working closely with Carla for about a year and a half now. And right now we're also working closely with Carly Ash. She's currently a PhD student in the Department of Sociology here at UMB, and she's serving as our research assistant. There have been others as part of the team over the past few years. There have been other professionals involved. We've had students, grad students assisting with the work who have moved on to other opportunities. So we do thank them for their contributions to this work as well. It hasn't always been just the three of us. And I would like to say special thanks to the MMFC, Denny, Michael especially, make my life so much easier in coordinating some of this work, from navigating some of the administrative items, keeping us organized, setting up webinars, meetings. I really couldn't do it without you, so thank you so much for all your support as we work through this as well. I guess go back in time a little bit, a few years, because Awareness to Action, or A2A as we call it, it was not the first iteration of this work. It began as a study by the name of Supporting the Health of Survivors of Family Violence in Family Law Proceedings, and that was initially funded by the Public Health Agency of Canada. And so this project was designed to really enhance support to survivors of violence through the family law system by increasing the opportunity for practitioners in the field to have some training, to have some guidance and resources as well to support trauma-informed practice and to improve the coordination of services as well. So communities of practice were established within each region, and various learning opportunities and resources were developed and circulated. This included things like legal bulletins of recent court decisions that were related to family law proceedings, research briefs on topics that summarize some key issues or challenges or information in this area, and webinars as well. And that funding ran from 2020 to 2023. So from there, this work did continue, and A2A was established. This is now funded by the Department of Justice Canada. So that started in 2023, and the projected end date of that funding is March of 2026. So we have a few months left. So to be a bit general here, that initial iteration, the initial 3 years, really emphasized collecting these resources, identifying what the issues are, networking and collaborating with professionals who are directly involved in these cases. And now A2A is more focused on implementing the tools to support this work. So kind of going from the theory to the practical side of things. Because it was determined that there is a pressing need for improved assessment tools and resources to help family law practitioners and service providers to better identify family violence and evaluate its risk when creating things like parenting plans or safety plans within those family law proceedings. So the main goals of the current project this last 3 years is to promote standardized screening to enhance procedural decision and recommendation making by professionals who are involved in family violence related child custody matters, to provide some learning opportunities to further build capacity of all practitioners in the family law field, to create some more standardized guides and guidelines for parenting plans, and to continue to support knowledge mobilization and collaboration through those communities of practice. So the work that initially started back in 2020 still all continued through A2A. The research continued. We're still producing legal bulletins. We're still producing research briefs. We're still doing webinars. All of that continued. The work with the communities of practice still continued, all in addition as well to the development of a new assessment tool. So I will talk about the COP, the community of practice, and the assessment tool in more detail. So we have 5 communities of practice that were established throughout Canada to facilitate those discussions and collaboration, especially around regional and local contexts. And so as I mentioned, these were established in the first phase of the study, if you will, and has continued into A2A. So for us, we generally have about 3 to 4 meetings a year that are held virtually. So community of practice members are expected to attend those. And within these meetings, we're really continuing the conversations around what's happening in our respective regions, what some of the challenges and barriers there are for working with survivors in the family law context. The COP members also attend our webinars. They also may suggest topics that we should be bringing to the forefront, either as a webinar training opportunity or something to discuss in a research brief, or if they know of recent cases that would be interesting to do a bulletin on, they're very involved in that, as well as disseminating all of those knowledge products within their own networks as well. I will mention in more detail the assessment tool that is in development, but they've been instrumental in the development and the testing of that too. So I would say right now for us, we have about 25 as a rough count of members of our Atlantic community of practice. And they do range from around the Atlantic region. So we have folks right here in Fredericton. We've got folks in Nova Scotia. We've even got a couple folks out in Newfoundland. And they come to these meetings from a variety of roles. So we have those who work in victim advocacy, or they might be part of shelter transitional houses. We have other members from various community-based organizations. And of course, we also have individuals who work within the family law context, or I should say Crown prosecution in these kind of situations. And that's similar across the country. Our other regions also have their own communities of practice with similar roles of individuals involved there as well. The big thing that I wanted to talk to you about is the development of the new assessment tool. So there are a variety of risk assessment tools and safety planning tools that are out there in the ether. I will admit my research expertise is more in line with the criminal justice side of family violence, but we hear similar conversations coming up in the family and civil context as well, that a lot of the assessments that are most often used are not comprehensive enough to truly capture the nature of intimate partner violence and especially the impact on children. So a new web-based assessment tool, which is called the eSafer, is in development to be a tool that can better help professionals who are assessing family violence. And it does also include the consideration of coercive controlling behaviors, which is a topic that I think is really coming to the forefront in family violence, intimate partner violence research right now. The eSafer also considers the impacts of co-parenting and children themselves in situations where family violence has been disclosed. So the development of the eSafer, it comes from 3 other frameworks that are already implemented. One of those being the HELP Toolkit, which does contain information on identifying and responding to family violence for family law legal advisors. The second one is the SAFER, which stands for Screen, Assess, Focus, and Respond. This one was developed by the Battered Women's Justice Project. And this particular framework includes things like parenting plan guidelines for evaluators and for judges aligned with specific developmental, emotional, material, and practical needs of children. There's also guidelines for appropriate parenting assessment, the means of assessing parenting readiness, and things like that. So that's all in the SAFER. And then the RIA is an assessment that is considered to have strengths in considering vulnerabilities experienced by families, and as well to assist family law practitioners in taking steps to more effectively address danger and high levels of risk. The RIA also considers incidents more than just physical abuse, as well as considerations of other intersecting vulnerabilities, which was noted as a gap in the second one, the SAFER there. So essentially each of these 3 tools and frameworks have a specific purpose. They all have their own strengths as well. And so by bringing them together in the development of this new tool, we can combine these, we can streamline some of that information and standardize hopefully a little bit better information about how family violence content is gathered. So this is a web-based guide. It's also designed to be bilingual as well. And new and trained users can log in and start working through various topics. So as a few examples, there's kind of little drop-down menus on the side of your screen that might probe for questions around the current parenting relationship. There are questions around understanding some of the unique circumstances like culture, identity, physical health, mental health, things like that. The impact of children is also considered. Coercive control is its own sub-theme as well in this assessment. And there are questions as well around other forms of abuse in the relationship, because of course it's not all physical, right? So those are just a few examples of the kind of questions that are in here. The user can also rate as they are clicking through things that might be very frequently occurring in this family, not at all occurring, somewhat occurring. There are some scales that can be clicked on as well. There's also notes pages that pop up that kind of follow the user through the guide. So as the user of the tool is discussing these questions and having these conversations with the survivor and or parent, they might be one and the same, and there's something that comes up that they want to go back to later or remember, okay, I'm going to ask about that when we get to that next question, or add further detail about why they answered a question in a particular way, whatever it might be, the user can go ahead and in the bottom just type notes to themselves as they're going through. And it allows the user to kind of bounce around a little bit, because even though the tool is set up with certain themes and certain types of questions, we know these conversations are not always linear. People might jump around, and so the guide does give some allowance to be able to do that. On the right-hand side of the screen, as you're going through the assessment as well, there's also the list of lethality factors from tools like the danger assessment. And so if really high-risk markers come up during the conversations with the parent, then the user can just go and check those off as you go, and those are always present as well. The other thing the eSafer does is it summarizes key information in accordance with federal and provincial best interests of the child criteria. So the practitioner or the user who is using this tool can select the relevant legislation, and the assessment is going to summarize that information that's been entered into the assessment in accordance with that legislation. So the Federal Divorce Act is included in this as well as an option, but as well as various provincial content. So for example, the New Brunswick Family Law Act has also been incorporated into this, and legislation for all of the other provinces as well. So just to give you a little example, it gets really specific, but within the New Brunswick Family Law Act, let's say that's selected, when the user or the practitioner downloads the responses and that legislation has been selected, so let's say there's section 50 subsection 4A in this legislation that inquires about the nature, the seriousness, and the frequency of family violence and when it occurred. So that will show up as a line on your downloaded document. And then the responses that the user provided to the assessment questions about rates of monitoring, tracking and isolating, physical abuse, manipulation, things like that will show up underneath this kind of legislation heading. So what the tool is doing is it's automatically grouping some of the assessment responses to align with the relevant areas of that legislation. No information is stored on this online platform. It doesn't save online, but I mentioned the user can download the content as they go through it or when they get to the end, and it will open up those results in a Word document on the user's computer. So beta testing of this tool was done, I'll say, largely last fall by all our various regions. We did host a beta testing training day here in Fredericton for frontline staff who were interested in being testers of this tool. The lead developers in Ontario did come out to run this training and also answer questions from our members as well. And it's gone through a few further revisions and fine-tuning since then, of course. And now we are into the stage of rolling this out further and training more new users of this tool. We're also developing some train the trainer kind of sessions as well, so that the use of this tool can continue even after our current funding period has ended, because we are getting close to the end of that. Right now, it's not available for just anybody to go in and start using it or playing around with it. So the developers do require that anyone using the tool has been trained to use the tool and is familiar with its content and what the intended purpose of it is for as well. And so the training that is done on this, it's a one-day kind of session training. So I will put a plug in right now to say we are looking for more participants who might work in this field, or if you know somebody who's working in this field who might use the tool or want to learn more about it and might be interested in some training. There is a training day being scheduled in Nova Scotia in November, but if we have enough numbers locally, we can set something up here in Fredericton as well. And again, it would be a one-day commitment. So please tell your networks. There's a couple other things I wanted to mention. So we do have a lot of resources out there that have been generated as part of this project. So I did want to highlight a few recent things that have come out of our Atlantic region specifically. The project website, I know it's kind of small, but it's right here. You're welcome to go in and take a look at that. That's where all of our bulletins, our briefs, and our webinar recordings are held. So for us, in June, we did host a webinar about responding to the crisis of intimate partner violence and homicide amongst older adults. So it had not gone unnoticed that in the past year, several intimate partner homicides in Nova Scotia included victims and perpetrators over the age of 50. So it sounds odd to say we didn't want to capitalize on that, but we thought this is an area that does need to be discussed more. There is research lacking about intimate partner violence and homicide in older adults. So we hosted a webinar about this particular topic. We had Catherine Cake and Lisa Marie Hunter from the New Brunswick Advocates Office join us to present on that, and Christina Fifield, who's a trauma therapist in Nova Scotia. So they discussed things like the rural complexities in older adults with intimate partner violence, unique health effects of older populations, financial challenges that might come up here as well, and some of the intersections between how we're classifying intimate partner violence in older adults with that of elder abuse, and how, if we're not classifying them correctly, gaps can be emerging in responses to it, as well as noting various resources and assessments that legal counsel might be able to undertake. So that's available on the website. You can go back and take a look at that recording from this past summer. And so from that, a lot of really good information came up, and so we decided to piggyback off the webinar and produce a research brief on this same topic as well. So we are in the final stages of wrapping that up and anticipating that that will be available for viewing by the end of this month. That would also be on the website as well. We also did another research brief earlier this year with one of our former research assistants, Misha. She was a PhD student at UNB at the time. She's since graduated, so congrats to her. But we produced a brief on the barriers to accessing legal support for family violence faced by immigrant, refugee, and non-status women in Canada as well. That's also on the website. And just as an example of a legal bulletin, there was a case that was heard by the New Brunswick Court of Appeal about determining best interests of the child. And so that's also available online too. There are dozens and dozens of these types of resources. All of our partner research centers, they're producing these kind of things as well, and they are all compiled on this website. So we encourage you to go and take a look at those, use them in your work, refer to them. It's all available. My email is also here if anyone is interested in eSafer training. I welcome hearing from you. We'll see if we can get something set up. And yeah,